Systemic lupus erythematosus. Systemic lupus erythematosus or SLE is a multisystem autoimmune disorder related to the antibody-mediated cellular attack and deposition of antigen antibody complexes, common in African women, highest at childbearing age. These patients usually present with non-specific symptoms such as fever, anorexia, weight loss, and systemic joint pain. The criteria for diagnosis of SLE is a discoid rash, oral ulcers, photosensitivity, arthritis, mallow rash, immunologic criteria, neurological symptoms like lupus, cerebritis, and seizures, elevated ESR, renal disease, ANA is positive, and serositis, pleural or pericardial effusion, and hematological abnormalities. If the patient has 4 criteria, they are likely to have SLE and 95% sensitive and specific. A positive ANA is highly sensitive but non-specific. Anti-DNS, DNA, and anti-SM antibodies are highly specific but not sensitive. The other important groups is a drug-induced SLE and neonatal SLE. The drug-induced SLE is anti-histone antibodies are seen positive, and neonatal SLE are associated with anti-RO antibodies transmitted from mother to neonates. The SLE can be associated with antiphospholipid antibodies and antiphospholipid syndrome. Anemia, leukopenia, and thrombocytopenia can be present, and proteinuria and CAS can be present in SLE nephritis. Leukopenia, thrombocytopenia are most commonly due to immune-mediated destruction, and there are other mechanisms also. SLE can cause pancytopenia due to concurrent peripheral immune-mediated destruction of all 3 cell lines, and marrow suppression can also be the cause of pancytopenia. So the treatment includes management of the pain, for which non-steroidal anti-inflammatories can be given, and if the patient has exacerbation of pain, then one can use corticosteroids, and hydroxychloroquine can be given with cyclophosphamide. Azathioprine can be used for progressively refractory cases. A few cases have specific issues. Hydroxychloroquine can be used for isolated skin and joint involvement, and the side effect is retinopathy. Cyclophosphamide is used for severe cases of lupus nephritis, and one has to do the renal biopsy for the patient for nephrotic syndrome and nephrotic symptoms, especially if the patient has proteinuria or CAST.